I'm Lauren Sonnenberg with LifeCore, which is my private practice in Miami, Florida. I'm a psychotherapist and wellness consultant specializing in the treatment of the emotional aspects of chronic pain and illness. And today I'm going to be talking about lymphoma, Hodgkin's lymphoma, or otherwise known as Hodgkin's disease. And we're going to be looking at it through the lens of German New Medicine. German New Medicine is the science that I use when looking at people's ailments so as to be able to identify the emotional conflicts involved in any person's illness. Now, before we get into a further description about lymphoma according to German New Medicine, I will just say that, of course, I've introduced myself here now, and I'm not a medical doctor, and so I'm not giving you medical advice. Please take this information as educational material. You can further explore it yourself. The German New Medicine website is learninggnm.com. And you could take this information to your doctor. Many doctors are unaware of this information, but it's going to take a little while till this information gets out and about and becomes common knowledge. So if you are putting this information out there, give yourself some credit for sharing some very powerful information with others who may benefit from it as well. So, according to German New Medicine, the thing that sets all disease processes in motion is an emotional conflict that is unexpected. So it's actually an emotional conflict which is at the same time a biological conflict. I actually like to call it a bio-emotional conflict, but for ease of learning this, let's just call it an emotional conflict. So in the case of lymphoma, we see a self-evaluation conflict. So what's a self-evaluation conflict? A self-evaluation conflict is any time you experience an unexpected breach to your self-esteem. It could be a general, global feeling less than in some way because of something that has happened to you or something that you've done. For example, it could be because you've injured a part of your body and you feel now that that area of your body is weakened or devalued in some way, or such an event may make you see your worth as a person because maybe your identity is impacted by this. For example, let's just say there's a person who is just very, very sports oriented and they get their worth through their athletic ability, and if they're injured and they can't play for any length of time, then they may internalize that as a self-evaluation conflict. The other thing that we often see with, say, lymph nodes would be if a woman has had a mastectomy of one or both of her breasts, the lymph nodes around that area may develop lymphoma afterwards, which would typically be seen as metastasis potentially, but actually, according to German New Medicine, that area of the body may be, if viewed by that person as weakened or devalued in some way, if it's emotionally internalized that way, then you could have a self-evaluation conflict. So you can see a number of ways that we can experience this self-evaluation conflict. And it can hit a number, or I should say impact a number of tissues in the body, or bone tissue as well. And so in this case though, with lymphoma, we're talking about, of course, the lymph nodes. So we have a medium level self-evaluation conflict here. And now for the two-part disease process, and I put disease in quotes because it's really not a disease. We're actually having a functional response here. There's a biologically special and significant program that is run for each one of these conflicts. So when the conflict is active in the self-evaluation conflict of a medium level, what we will see is cell loss in the conflict active phase. There will be loss of the the lymph cells in that conflict active phase. When the conflict is resolved, what you see is a regrowth of those cells. And so that replenishment is cell growth, which is cancer. The cancer, in the case of these new brain-controlled tissues, is the healing. And when I say new brain-controlled, what I mean is some organs and tissues of the body are controlled by the brainstem and the cerebellum, which are old brain-controlled, and some are controlled by the cerebrum. And in this case, the lymph nodes that we're talking about would be new brain-controlled or cerebrum-controlled. So there we see, to reiterate, cell loss in the conflict active phase, cell regrowth in the conflict resolution or healing phase. So what we don't want to do here is interrupt the process. And almost always, if someone's being treated in the conventional medical process, then there's almost inevitably some chemotherapy involved. And according to German New Medicine, and as again I'm stating, this is just educational information, you can bring it up to your doctor if you'd like. At that point, since chemotherapy is a sympathogenic agent and you're already in this healing phase, which is the vagotonic phase, this chemotherapy applied in this phase will hold back the healing or slow the healing down or make it harder for the body to heal because the body's already in the healing process. So you see better outcomes even when chemotherapy is used when it's a new brain-controlled tissue or organ that's involved and you are in the healing phase already. So it makes it look like chemotherapy is working, but you would, according to German New Medicine, have very, very wonderful survival rates if the natural healing of the body was not interrupted. Now what we see with old brain-controlled tissues and organs is if a person is conflict active and the cells are growing during the conflict active phase, because with those, the cells grow in the conflict active phase and they break down in the conflict resolution phase, you can actually, the chemotherapy at that point will actually cause the cancer to grow more. So this is why German New Medicine is so important for consumers to be aware of, and obviously for the medical profession to be aware of, because all the doctors I know really want to help their patients, and this information empowers people to help the people that are in their care. It empowers practitioners to help the patients that are in their care, and that's largely the reason I'm making this video and the series of videos I plan to make afterwards, because this information is so vital to the well-being of everyone that it needs to be put out there and made available for all to really learn. So I do thank you for listening and for distributing this information if you choose to forward it on to people who would be interested. We're in a learning curve here. There's a process of getting new information put out there, and I semi-jokingly bring up the flat earth theory sometimes when I'm talking about German New Medicine, because really at one point in time pretty much everyone on this earth believed that the earth was flat, and turns out it's not, and that's kind of what's happening here too as well. We're going from a fairly well established germ theory type medicine with an emphasis on theory, because a lot of that is not substantiated. There are a whole lot of question marks out there where they can't really explain why people get this disease or that disease in many cases, and why certain treatments work some of the time and not other times. So here we're shifting from the germ theory to potentially taking on German New Medicine as the lens through which we see the whole biological healing process. And this empowers people to a very great extent. So once again, thank you for your time, and I wish you well in your education about this German New Medicine and in any healing processes you might be involved in at this moment. Take care.